I wanted to find out one of the key findings I wanted to figure out because this was coming from my patients. They're business owners, they're CEOs, they're CFOs, and they would complain, complain, complain. And I realized that I needed to find out how insurance was bought and sold to systems and how an employee health plan was actually set up. So that's where I began. And I started to buddy up to different insurance people. I kind of started to get networked into those groups. And what you started to realize is that 85% of insurance brokers don't even know that an independent world even exists. They do not even know it exists. And then you start to, we can talk about this till the cows come home, but the incentivization with insurance brokers has traditionally been, well, if the employer's, costs go up, the broker makes more money. They actually make more money if the company's health plan is doing poorly. So if it goes up another 10%, well, the broker makes another 10%. If it goes up another 20%, the broker makes another 20%. So there was literally no incentive for brokers to try to institute anything that might help save the company money. They just wanted it to go up and up and up, and that's the way it worked. So that was one obstacle, is probably 85% of brokers don't even know there's an alternative out there. And if there is, they don't even care because that's not the way they operate. The second obstacle has been human resource directors. Human resource directors, they really have no training in healthcare. What they do is they come out and, they learn about all these different aspects of a company, mainly complaints and job actions and all this kind of stuff. And what happens is the CFO or the CEO kind of dumps healthcare on their lap. Well, to an HR director, this is something that's way too complicated. And they just want easy. They don't want a problem with it. They just want easy. They don't want 45 people calling them up complaining about their new employee health plan. They don't want 45 people calling up and complaining about, I can't get anything I need. They just want it easy. So the oldest saying in the human resource world is, no one's ever going to get fired for installing United Healthcare in your employee health plan. But that might be starting to change because when the costs keep going up 8, 12, 20, 30, 40% a year, well, now people are starting to think about getting fired for putting in these traditional products. Human resource directors combined with the brokers have sort of been a barrier to these new concepts getting through to the CEO. So there's really been a two-pronged approach by people. My approach has been top down. I try to talk with the CEO, the money people first, because I explain to them how it is that installing high quality primary care right into their company and doing it in a thoughtful way, coordinated way with the broker can save their company just enormous amounts of money and give their employees way better care. So you have to start there and kind of move down to the HR director and kind of get them to buy in, and then that helps. The other approach is the bottom up, and that's where you meet with brokers, getting them to understand what it is you're offering and try to get them to start learning about it. And unfortunately, Steve, you know this. How many times we've talked about this? We're talking maybe, 5% of brokers? At the most, maybe 10% of brokers. 10% will want to learn about it, and then in the end, you're lucky if you get 3% that actually go to a company and say, you need to do this. This is really going to help your company. But going from the bottom up, the broker approach has been the strategy from other organizations. So I'm trying to do top down. Other organizations are trying to do bottom up. Between the two, we're hoping that we start to get somewhere with this.